In September 2018, Harare experienced a resurgence of the deadly disease cholera in the suburbs of Budiriro, Glenview and Glenora. Tens of thousands of people were at risk from this ferocious waterborne disease, born out of a shortage of clean, safe drinking water and the flowing of raw effluent into the water sources.
Oxfam in Zimbabwe managed to engage with the city of Harare in September 2018 for a cholera response. We had a surge in diarrheal cases in September that ultimately led to a cholera outbreak. And Oxfam is the provincial focal agency for water sanitation and hygiene in Harare, and hence is mandated to be helping the city of Harare with saving lives. In September 2018, Oxfam managed to get into the areas of Glenview and Budiriro, which were the hotspots for cholera, and managed to actually work with the local authority to define the parameters within which it would actually exercise its mandate for crisis response, to also make sure that we work towards preparedness, and to also make sure that communities themselves are better able to respond to crisis.
Takambosangana nematambudziko ekorera. Kune vanhu vakatopera kufa vanototi ndotowaziva nedzimba dzavo pawakafa wakafa nenyaya yekorera iyoyo. Nyaya yekorera iyi yakanga ichinyanya kukozwa nekushaya mvura. Vanhu vanga vasina mvura yakachena. Vanhu vaimwa mvura yematsime, vaichera kumatsime uko kumasuweji uko kunosangana mvura yemasuweji nemanhiki, vaichera kumatsime imomo vachichera mvura. Saka vaingonwa yakadaro vasati vaita ruzivo, vasingabhoili, vasingaise kana chimwe chinhu, vachingonwa chete ngoti tiringonwa mvura sevanhu vangori mudzimba.
Zvakanga zvaitika, vanhu vakanga vapera kufa netyphoid, vamwe nekorera, zvokuti vakawanda, takarasikirwa zvikuru nehama dzakawanda.
Takasanganawo nedambudziko rekorera gore rakapera. Ndofunga zvakakonzerwa nekuti pataichera mvura isusu taifunga kuti imvura yakachena, taichera pairaki kuti chagarika mvura yekumwa, taifunga kuti ndomvura yakachena. Saka mushure maizvozvo takazosangana nedambudziko rekorera. Baba nemwana, vana vairi vakaenda kunazareta, vakagara kunazareta. Ndakatozoita mwana ari grade 7 wekukumbirira kuti auzonyora grade 7. Pakatozoshaika umwe mwana pamba patinogara nedambudziko rekorera iroro. Paikauya isati takuziva kuti ikorera, takatozoona kuti yanga iri chirwere chatobata nzvimbo yedu yeGlenview. But pakutanga tatangotopa mwami noti chirwere rudzi.
We began to experience a lot of problems with regards to water supply, mainly because of the drought that we experienced, that is last year, and also some economic challenges that we are experiencing as a nation. So residents here in Glenora, they would sleep in the queues, queuing for water, maybe for one bowl in a ward.
Medu matiri muward 33, takanga tine dambudziko rekorera, waterborne diseases, ndo problems atanga tinawo.
Didn't have any public toilet, and when our patients or mostly the visitors, when they come to visit to check on their patients in the wards, it was a problem because they didn't have anywhere to go so that they can relieve themselves.
Oxfam, as the provincial focal agency for water, sanitation and hygiene in Harare, swiftly moved in to avert potential severe loss of human life. In partnership with the local authority, they embarked on several initiatives which included rehabilitation of numerous boreholes and installation of inline chlorinators to ensure the water was clean and safe. Over and above that, they went on a rigorous program to educate and raise awareness among community members on health and hygiene.
As Oxfam, along with City Health, we conducted a rapid assessment to determine the number of people that were affected. Following that assessment, we quickly responded in two ways. The hardware, which is installation of a wash facility, as well as software to promote good hygiene practices. Under the hardware section, to date we have managed to rehabilitate 53 boreholes and also installed 53 inline chlorinators to ensure that water is treated before use by the community. We have also rehabilitated 3 toilets at health institution in Glenview, Budiriro and Glenora, and we have also constructed one latrine at Beatrice Infectious Hospital. We have also constructed a pipe dress scheme at Chagarika in Glenview, the hotspot area which was affected by cholera outbreak. Then, in an effort to also promote improved hygiene practice, we trained 200 community health volunteers from the 3 targeted suburbs, who were then supposed to reach out to 200,000 community members through door-to-door hygiene promotion in health clubs in Glenview, Budiriro and Glenora. We have also conducted some road shows. We are also promoting hygiene through radio talk shows in an aim to reach out to all citizens in Zimbabwe.
We've been learning a lot about maintaining good health and sanitation, and we've been extending the health promotion at school level, home level, as well as community level. We've learned about cleaning, washing our hands, and cooking food thoroughly so that we can reduce the implications of being affected by cholera.
Oxfam yazouya izvozvi yakatidzidzisa takabva tazopinda mumaclubs vatanzi ngatiite mahealth club. Mahealth club ndiyo yangoma ndindinde yekuti iri kutibatsira zvikuru. Isusu tiri kufamba door to door tichieducata vanhu nenyaya yehygiene yekuti vakwanisewo kuti wararame upenyu huri nani, upenyu hwakanaka, upenyu hunoenda mberi nekunge vachidya zvinhu zvakanaka zvisina tsvina, vasinga vachimwa mvura isina madisease, mvura inenge yakati kana vachichera mumatepi vanenge vachibhoilisa mvura yavo kana kuisa water guard.
First donation by Oxfam was the sinking of a 55-meter bore and 3 5,000-liter tanks which we received from Oxfam. And from that period, we have always been having enough water for our learners plus the community. The community is benefiting from this donation. We actually give them a timetable to follow, to come and fetch water in the morning from 6 up to 8 and then from 4 p.m. up to 6 p.m.
Project yatakaunzirwa neOxfam tiri kuwana mvura yakanaka ine mishonga yakatreatwa ende kanyange mawanira acho hatite zveenergy chaizvo zvokuti tinogoja kungovhura 2 minutes tatokumba hatiswerere pachibhorani. Saka regai tingotenda nezano iro rakauya nevanhu veOxfam.
Patakazochererwa bhoho iyoyi takaona kubatsirikana zvikuru. Iye zvinezvi kana kuti tichinwa mvura yepatepi aiwa hazvichaita, takungonwa iyo bhoho water.
Ndiye akatanga ichitiisira mabhoho mvura yekumwa yakachena, mvura yekumwa yakatreatwa. Saka zvekuti kufa kwedu kwakushoma.
I'm so grateful as the officer responsible for this area, because even the issues that are now coming up, they are reduced. We are not able to supply water as a city on a daily basis, at least maybe 2 or 3 times a week. And also some areas will not even manage to get the water because of the pressure levels and depending with the gravity or the terrain they are situated. But these boreholes are going a long way in helping and assisting our residents.
Tinoona kunge takabatsirwa zvakanyanya chaizvo neOxfam panyaya dzezvibhorani, because zvibhorani zvedu zvawanda, zvibhorani zvedu zvakuwana mapiritsi ari chlorinated achibatsirwa nekuuya kweOxfam neawareness yavari kuisa muward.
The work that we undertake in our humanitarian responses, we have partners that help us to carry the message along and also to make sure that we are working with communities to save their lives. So within the current financial year, running from September 2018 to September 2019, we've been working with DFID, UK Aid. We have our institutional donor, UNICEF, who has been supporting us through and through to make sure that we are transitioning not only to saving lives, but also to building resilience amongst the communities that we are serving.
To actually want to recommend that if you would have gone maybe further, if you would have extended your program maybe up to at least end of this rain season, at least if you could at least observed if we could have enough rains in this year. But anyway, we are so grateful with what you did to us as an organization.
Tinenge tichitokurudzira izvo zvokuti dai zvaramba zvichienderera mberi because dambudziko rekorera hariperi.
Dialogue that is happening between City of Harare, Oxfam, other agencies that are responding in Harare, communities at large, and we are also working to ensure that we sustain the efforts within which we invest. Oxfam also has its internal funding through its discretionary fund that is working precisely to ensure that we have safe water access to communities that are traditionally facing recurrent crisis. So Glenview and Budiriro have really become target areas for us to be instituting localized piped water systems where we are making sure that communities know the areas that affect them around the safe water chain and they are able to mitigate against crisis.